Good afternoon and welcome to the Center for Interdisciplinary Health Workforce Studies Fall Webinar event, focusing on the latest trends and research in the nursing workforce. We are pleased to have you all joining us for today's webinar. My name is Christy Friedman and I'm the Program Manager for the Center. We'll start with a few center announcements before we begin today's webinar. First, we've posted RN employment data and aging trends to our website for the second quarter of 2016. Overall, total employment of registered nurses increased substantially during the second quarter of 2016, and employment and growth in hospital settings was especially strong, and on a national basis, still not seeing an apparent surge in RN retirements. No apparent surge in RN retirements was observed during this time period. Second, we are organizing a series of webinars focused on the primary care workforce in the U.S. Our first webinar will focus on the soon-to-be-released recommendations coming from the Josiah Macy Foundation. The Foundation convened a national summit earlier this year that focused on expanding the role of registered nurses in the delivery of primary care. So please be sure to save the date for October 26th at 2 p.m. Eastern Standard Time for the first of this series. Finally, I know summer is almost over, but it's not too early to be thinking about summer 2017. Save the date and make plans to attend the 2017 National Forum of State Nursing Workforce Centers annual conference titled The Nursing Workforce and Health Reform, Trends and Opportunities in a New Political Era, which is going to be co-organized by our center. This conference will be held June 7th through 9th at the Grand Hyatt Denver in beautiful downtown Denver, Colorado. More details, including call for abstracts, sponsorship information, and registration information will be coming soon. Again, please visit our website for this and more information at healthworkforcestudies.com. After today's presentation concludes, we will have 15 to 20 minutes for discussion and questions and answers. Please feel free to type any questions you have in the area designated for questions on your menu bar, and we will get to as many of your questions as we can. We are also recording the webinar today, and we'll have it posted to our website. And we have also posted all of the previous webinars to our website if you have missed any of our previous webinars or just joining us for the first time today. You can also find presentation slides for many of the webinars posted within the Event Calendar tab on the Center's website. Today's webinar will provide a deeper dive into the female-male pay gap in nursing by examining additional explanations that could explain the gender pay gap observed in nursing. Now I would like to allow Peter Bierhaus, Center Director, to take a minute and introduce our speaker, Dr. Ulrike Muench. Pete?
Hey, thanks, Christy. Hey, it may still be summer in Nashville, but it is fall out here. The leaves are changing, and probably another 10 days we'll be at peak. But a cold front's coming in tonight, and I think the mountains will be wearing white snow in the morning. So all you skiers, think about coming out this way for some great skiing this winter. So I am really particularly pleased and proud to introduce Dr. Ulrike Muench, who is an assistant professor in the Department of Social and Behavioral Sciences at the University of California, San Francisco School of Nursing. The reason is particularly that Uli and I worked together closely at Vanderbilt for 3 years while Uli was doing her postdoc there. So we've discussed this paper and analyses that surrounding this many, many times, so it's wonderful that she is here to present. So Uli holds affiliated faculty appointments at the Philip R. Lee Institute of Health Policy Studies and the Workforce Center at UCSF. She's a nurse and a healthcare economist with a program of research focused on the healthcare workforce. Uli's research has been published in several leading healthcare journals, including the New England Journal of Medicine, the Journal of American Medical Association, and Health Affairs. She's extensive experience working with large survey data and administrative claims data. She's currently doing research examining the prescribing differences between nurse practitioners and primary care physicians using Medicare data. And she's also evaluating outcomes of scope of practice for nurse practitioners, and studies that involve the earnings differences in nursing in an international context. We'll be hearing about the national scene in just a minute. So Uli completed a postdoctoral fellowship at Vanderbilt University that I mentioned a moment ago, and she also holds degrees from Yale University and the University of Cambridge in the UK. So Uli, it's great to have you start us off this fall webinar series. So I'm going to turn the microphone over to you. Uli?
Yes, thank you, Pete, for this lovely introduction, and thank you, Christy, also. Welcome, everyone, and thank you for joining us today. Let me begin by giving you a brief overview of the webinar. The goal of the webinar is to explore some potential explanations for the gender pay gap that we, as well as other scholars, have documented, and to look more closely at what might be driving these pay differentials of male and female nurses, and for us to have a conversation about how this earnings gap might be addressed in the future. My slides are not advancing. Christy?
Yeah, hold on just a second. Let's see. Maybe exit the slideshow and try one more time.
Okay. Great.
There we go.
I will begin. Yeah, great. I will begin by summarizing our earlier findings that we published in JAMA last year. We will then move to exploring possible causes that could be potential explanations of the earnings gap. Most of the results that I will be sharing with you today in part 2 of the webinar are forthcoming in the October issue of Nursing Economics. But I will also show you some more new preliminary results of an analysis that uses a sample of German nurses that are not yet published. And I very much look forward to hearing your thoughts on this topic and your questions about this research during our Q&A time. The background for today's webinar is a research letter that we published in JAMA last year. In that study, we reported that earnings for male and female full-time RNs in 2 data sets, the National Sample Survey of Nurses and the American Community Survey. I'm sure that most of you who have joined us today know about these 2 data sets, but for those of you who don't, the National Sample Survey is a representative data set of registered nurses that has been carried out since 1977. It has been repeated every 4 years since 1988 and was discontinued in 2008. We used this survey from the year 1988 and forward, when the variables became more comparable across years. The survey is known to have particularly rich information on demographic and workplace information and reaches approximately 30,000 nurses. The American Community Survey, on the other hand, is a census-level household-based data set, which is repeated annually. It also yields a sample of approximately 30,000 nurses and holds the most up-to-date information on earnings of nurses. We can also see from this figure, we showed that unadjusted earnings gap for male RNs are approximately $10,000 higher than the earnings of female RNs in both surveys. This $10,000 gap is the difference between the solid green line, the male earnings line, and the solid yellow line for women. We can also see from this figure that this earnings gap has persisted over time. We then tested whether male RNs also earned more after adjusting for a rich set of variables, which included demographic characteristics such as race, marital and child status, human capital characteristics such as education, years of experience, and work and employment characteristics such as hours worked, the work setting, clinical specialties, and job positions, as well as the state in which RNs worked in. Rural and urban status was also included. For this analysis, we only used the National Sample Survey because it has all this rich information that economists believe is crucial in explaining the earnings gap. This regression essentially compares a male nurse with a female nurse who both, let's say for example, work in a hospital setting in the state of New York as a staff nurse on a medical surgical floor. They both have a BSN, work the same number of hours, and have worked the same number of years. So in the data with all the information that we have available, they look identical. In this regression, male RNs earned on average approximately $5,000 more. This is equivalent to an 8% difference. The adjusted earnings difference is shown by the dotted line in the figure. So with all the information that we have available to us to compare the characteristics of male and female RNs, the variables in our model are able to explain about half of the unadjusted earnings gap. We did also do follow-up adjusted analysis with the ACS using the variables available to us in those data, which was not published in the JAMA article. The difference between the surveys is that the ACS does not have information on where the nurses work or what kind of job position they have. It does, however, have human capital variables such as education and experience, which economists believe go a long way in explaining pay differentials. Using the variables available to us in the ACS, we found an adjusted earnings gap of about 9 to 10%. What this tells us is that having employment-specific information regarding the settings and positions that RNs hold can help explain an additional 1 to 2% of the earnings gap. I'd like to at this point mention that even though we have all this detailed information from the National Sample Survey, these are still not the ideal data to use. Ideally, we would have longitudinal employer-level data. This would allow us to follow individuals over time and would allow us to compare the earnings of a male and female RN who work side by side in the same hospital on the same unit. It is difficult as a researcher to obtain access to institutional level data, but hospitals do have these data available. Let's return now to the 8% gap that remained unexplained in our fully adjusted models. What do we make of this gap? This gap is small, you may say, given the 78 cents to a dollar number that you have heard quoted in the popular press. However, the 78 cents to the dollar is a very crude number that is not a valid comparison, as it doesn't take into account human capital factors such as education, years of experience, and the types of professions women enter. The true pay gap lies probably closer within the 6 to 9% range, and this figure is widely acknowledged by labor economists who study earnings differences, such as Claudia Golden, a famous economist at Harvard. She conducted a well-known analysis of audition procedures of symphony orchestras, showing that the women were more likely to advance and get hired if auditions were blinded, concealing the player's identity. For RNs, an 8% earnings gap adds up to approximately $150,000 over a nurse's career. Many do consider this a substantial gap costly to women that we ought to care about. So is it possible that this 8% remainder is due to possible gender wage discrimination? Economists argue that the remaining pay gap has likely other root causes. What are some of the possible explanations then? In our study that is forthcoming in nursing economics, we set out to test some of the most common causes believed to affect differences in pay. Let's start with the first one. Differences in motivations between genders. This reflects on the idea that men may have a greater appetite for competition and advancement in their careers. Male and female RNs may work the same number of hours, but male RNs may, for example, work shifts that have higher value to the employer, such as holiday or night shifts, while the female RNs may work these hours on their time without having them imposed on by the employer. Ideally, we will want a direct measure of motivation, but survey data do not typically include information on motivation. So what we did instead with the data that we have available in the National Sample Survey is using changing employers and position, as well as having moved states as a proxy for motivation. This is under the assumption that these are predictors of wage growth. Evidence from labor economics suggests workers can build human capital and increase wages through changing jobs. So workers who have high job motivation may have greater job mobility, changing jobs more often compared to workers with lower job attachment. Specifically, we made use of survey questions that assessed whether the RN was employed with the same or different employer and in the same or different position. We used these questions to create two variables indicating whether a nurse had changed employer and whether a nurse had changed position. Nurses who changed position were asked to indicate the reason for having changed jobs. They were given 20 answer choices. 2 of them were related to having changed for pay and having changed position for promotion. We also used information on what state the RN resided in the previous year to create a variable that indicated whether the nurse changed state since the previous year. These questions were available to us in 4 years of the National Sample Survey and pulled in a sample of approximately 51,000 full-time employed nurses. We conducted descriptive bivariate analyses using z-test of proportions to test for differences by gender on these 5 proxy measures of motivation. Men were more likely to move across states, and men were more likely to change employers. Of those who did change employers, male RNs were not more likely to change for promotion, but were more likely to change for pay. So this analysis provides some evidence for motivational differences between female and male RNs. Another possible explanation might be that men accrue more experience over time by working more hours. This greater experience by men may then increase their productivity and therefore their higher earnings relative to women over the course of their careers. To test this hypothesis, we analyzed a sample of nurses who were under 30 years old and who had 2 years or less of nursing experience. Because experience is more similar in new graduates than at any other point in time, this sample was relatively small and made use of all years of the National Sample Survey. We then conducted a regression analysis using the same model specification we used previously in the JAMA paper. And the results were that male RNs at the beginning of their careers also earned approximately $5,000 more than female RNs. This analysis provides evidence that differences in experience cannot alone explain the pay gap in nursing. Everyone knows, and not just economists, women take time out of the labor force to have and raise children, leading to interruptions for women, interruptions in career paths and productivity loss. This leads to lower earnings for women after re-entry and is commonly referred to as the motherhood penalty. We set out to test whether women without children also experienced an earnings gap. Ideally, we would like detailed information on the number of children a woman had and how much time they took out of the labor force for each child. However, this level of detail is not available in the National Sample Survey. Instead, we use a proxy measure for having had children, making use of a survey question that asked if children were currently living at home in a subsample of RNs between the ages of 40 to 45. This age range was chosen by applying the average population age of having a first child, which was approximately 25 to 27 years of age during our data period, and adding 18 years, the age young adults begin to leave their parents' home. We utilized all years of the survey for this analysis and had a fairly large sample. The analytical approach stayed the same and included the fully adjusted model. Results showed that even women without children experience a significant difference in earnings compared to their male colleagues, providing evidence that taking time out of the labor force for child-rearing cannot alone explain the earnings gap in nursing. This finding does also provide evidence for a phenomenon known as statistical discrimination, a term that refers to discrimination based on stereotypes and involves people inferring an average characteristic of a population onto all people. For example, employers may believe that all women will encounter a loss of productivity from child-rearing because the typical woman does take time out to have children, and infer this average characteristic onto all women, even those women who will not have children. These are 3 common explanations that economists believe contribute to the pay gap that is observed within occupations. However, there are some others that I would like to briefly bring into the picture as well, because I think they will be interesting for our Q&A session. Another root cause that has been put forward is that men are better at negotiating, and experiments in the lab have shown that this is true. Economists also believe that men and women have differential physical attributes that may be differentially advantageous, depending on the type of job one carries out. So could this play a role in nursing? Well, potentially yes, given that nurses are often required to move heavy equipment, and we also have a growing prevalence of obesity in the United States. So we looked for evidence of these explanations in our data. The figure that I'm showing you here was published as part of the JAMA paper. It shows the earnings gap by work setting, including hospitals and ambulatory care, the earnings gap by specialty areas, and the earnings gap by job position. And what this figure tells us is that the pay gap was larger in primary care settings. This is a setting where nurses may potentially have more room to negotiate. Hospitals may have better pay regulations in place, usually factoring in education and experience that can serve as a guide to determine the salary range for a nurse. The figure also shows the earnings gap existed in specialty areas that require little physical strength, such as newborn care, pediatrics, and job positions such as research and management. So negotiation and physical strength are also likely not to be the root causes. Maybe it is possible that the nursing labor market in the US attracts workers with many unobserved differences in skill and motivation. After all, nursing provides an entry and access to many different kinds of jobs in healthcare. Nursing is a respected profession, and many nurses obtain graduate degrees to become nurse practitioners, and some go on to get their PhDs. But this is not the case in all countries. Germany, for example, still trains nurses primarily in an apprenticeship model where students are enrolled at vocational schools and not at university. Nurse practitioner education is just beginning to get discussed, and this kind of labor market for nurses may be more homogeneous for the nurses that enter it. So I wanted to share with you some preliminary results from data on German nurses. We ran a very similar regression to our analysis on US data and have similar control variables. And what you can see here is that the earnings gap decreases with an increasing set of controls down to 9% in column 7. So basically, even in a labor market more likely to attract homogeneous workers, there is still an earnings gap in nursing. And I would like to use these results from the German nurses as a segue into our conversation to think about how we might want to address this issue of the earnings gap for nurses. Because one way of how we might want to think about addressing it is through more family-friendly policies, and the firms that do not reward 80-hour work weeks with twice as much as a 40-hour work week, for example. And Germany is known to be particularly liberal with their family leave and other family-friendly work policies in general. So it is somewhat surprising that we see a similarly large size gap in Germany. So what are we going to do about this gap, you might ask? So there are basically 3 broad categories that we can think about of addressing it. One is through government interventions, and the White House has already released some information and brochures for employers to have more open pay policies. And you can also think about expanding these policies, for example, by thinking about making like paternity leave a mandate. The other way to think about it is that we might want to improve women's bargaining power and a desire to compete. But that might but that might have some costs more broadly to think about, that we might want to change how women in general sort of approach their job searches. But certainly this is something that we can think about as an intervention. And also in terms of government intervention, what I didn't mention before, one could also be related to childcare, because there's a fair amount of evidence that it's not just when the children are young, but later on when they're in school, that this is a potentially very high cost for women. So sort of thinking about when children are older and school is over, sort of at 2 o'clock, where, you know, who are the people who then take care of these children? And more likely, these are women. So that leads me to the third point here, just the greater involvement of men in the home. So this, you would certainly think that this wouldn't be a cost, and something that we can kind of aim for. That it would be a good thing if men would take a larger role in the home, including childcare activities. So finally, I wanted to point out, and this is what's sort of getting discussed by economists at this point in time, is that within occupations, what is it that could be changed within the labor market? So one is what I already mentioned, is that if institutions don't reward sort of these high hours, sort of with twice as much pay as a woman who as a worker who works 40 hours, then this could sort of help narrow the pay gap sort of more organically within occupations. And so there is some evidence that has come out of the occupation of pharmacy that has shown that basically pharmacists do not have a wage gap anymore. And it's believed that this is partly due to technology advancements that have taken away some of the sort of higher level decisions that had to be made, because now they're like very standardized formulas in terms of what medications are to be used. And now with this advancement of technology, women are more likely, so a woman and a man become more substitutionable, for example, in the area of pharmacy. And so it's been economists have been very interested in following the wage gap, particularly in this occupation, because they were sort of saying that as over time, we might see a closing of the wage gap due to these developments. But when we think about nursing, I wonder to what extent this can really be the case, because you'll always need people who are on call and who work night shifts. And we do not, even though we have many clinical guidelines, we also do need a lot of clinical judgment that is required of us at any point in time. So while there's an opportunity for some occupations, perhaps this might have more. This might be a little bit more limited for nurses, but I'm really very interested to hear your opinions on how we might want to address this issue, and to what extent we think the nursing profession should care about this. So I look forward to your questions and comments. Thank you very much. And I may have spoken a little fast.
Great.
Yeah.
Great. Thank you so much, Uli. This was a wonderful presentation, and we've been looking forward to hearing more about this research since we first saw the initial piece in JAMA earlier this year. Okay, great. At this point, we're open to questions from the audience. Again, please use the questions area of the GoToMeeting toolbar versus raising your hand, as we cannot allow any speaking from the audience. So if you'll deliver your question in the questions area, I will relay as many of them as we can to our speaker. Traditionally, I like to give Peter Bierhaus the first crack at a question. So Peter, I'll let you start us off.
Thanks, Christy. Uli, thank you very much for the presentation. And I'm got a couple of things on my mind, but let me just sort of ask you one part A and then a part B. Part A is I'm always been struck looking over the years at how persistent the gap is. On the unadjusted, it was like $10,000, but this goes back for several decades. And I'm just curious if you have any further thoughts about why this is so persistent. So that's my first part A. And then part B is, I don't know, I keep trying to figure out other explanations. And one thing I've been wondering about, and you may have some information on this, is it's my understanding that human resources in organizations and hospitals manage the wage contracting with their employees. And I'm just curious if we know what the gender and the age of the folks in HR who oversee this function. And so you may not know that, but I'm just curious if you do. So part A is sort of, what do you think might be going on with this persistent decades, multiple decades difference, and do you know anything about the gender and age of HR people?
Yeah, thanks, Pete. These are both great questions. So with regard to the persistency in the gap, I mean, we have just been as puzzled by this too. You would think that that with more attention that's been paid to this topic in the media over the years, that we would see a closing of this gap over time. And it looked like that there was when the labor market, got tighter during the recession, that we saw a decrease in the wage gap during that time, but then it also widened up again. And in analysis that I didn't show you here, but I've been keeping a close eye on the latest years in the American Community Survey to see how the gap is developing there from our latest analysis that went all the way to 2013. And it does look like this gap is still persisting. And now that the economy looks rosier, it also looks like it is widening up again. So in some sense, it's possible that if there is more money available for employers, that then they're also more willing to negotiate within within these salary ranges that I do think probably a lot of organizations in nursing do have available to place their nurses within these appropriate age bins based on their education and experience. But yes, why this generally hasn't changed in the data that, in the sort of the time frame that we have looked at. I mean, going back, like, let's say 30, 40 years, that includes data from, the analyses from economists that have started to look at the earnings gap since, 1950 and forward. This has closed substantially, but there's a lot of evidence that within the last 20 or so years, while this big gap in terms of human capital characteristics and the sort of the 23% gap that you hear reported in the media, that has closed based on women catching up with education, more women generally entering the labor market. So you would think that also with the advancement of nursing education over time, that this probably contributed somewhat to a gap, but we still see this overall gap, and it is surprising to us too. But so economists sort of think that this final gap, to close that, really requires like an additional, a shift that has to happen to sort of close this final chapter of the wage gap. And with regards to folk in HR and their age or who these people are, I'm really, really interested in learning more about this group of people myself, and I know very little about it. I mean, it would be fantastic if some of our listeners who have who are maybe working in this area in HR themselves would wanted to weigh in to tell us a little bit more about how wage setting in hospitals, for example, actually is really done. As a researcher, I would love to really foster these connections and have closer communications that would then also inform our research questions.
Great, good idea, Uli. I'll let you know if I see anyone comment on the that they're in the house. We have a first question here. Did your experience measure account for non-nursing experience? If not, what type of role might this type of work experience play in explaining the nursing wage gap? For instance, if men are more or less likely than women to switch into nursing from other occupations where they have gained some work experience?
Yes, that's a really terrific question, and we have thought about this quite substantially. So there is evidence that men enter nursing at a slightly later age. So usually about 1 or 2 years. They're usually about 1 or 2 years older than female nurses are. So there is evidence that they do come potentially with some other kind of non-nursing related experience. So we generate 2 experience variables. There is one variable in the National Sample Survey that's specifically asking about experience in nursing, and then we also use the years since high school graduation as another experience variable. So we have looked at this both ways with these 2 experience variables. So that's how we've tried to include it in our analysis. But I do think this is very very interesting, and it does speak to the fact that that there are differences between male and female nurses.
Great. I have another question here. Did you do sub-analyses of CRNAs? Many more men in this high-paying field.
Not by itself, but because we did look at specialties, this was also one of the specialties that we looked at. So we didn't compare this group of nurses compared to other nurses to see whether that gap was statistically different compared to other specialty areas. But we do see a particularly in terms of dollar amounts, a particularly large gap in this area, but that's mainly driven by this being a very high earning specialty. The percent gap, I believe, is not bigger in that specialty compared to other specialty areas. But I would, if you would like to know that percent gap differences, I would like to probably just take another look at what those results were for that specialty and get back to our listener on the exact amount. But I believe it is not, by percentage terms, not larger than some of the other gaps that we saw by specialty.
Great. There's been a long history of building the age earnings profile. This may be a comment, and we'll see. We'll get to the end. Oh, there is a question. There has been a long history of building the age earnings profile into modeling of compensation. The challenge with the NSSRN is that the proportion of men in the 20th century was very small. The leveling of compensation for nurses over 50 would hardly have had a chance to kick in yet. Elderly female nurses have to wildly outnumber elderly males. Any thoughts on that?
I'm not sure I understood the question exactly.
Sure. I can repeat it for you if you'd like. There's been a long history of building the age earnings profile into modeling of compensation. The challenge with the NSSRN is that the proportion of men in the 20th century was very small. The leveling of compensation for nurses over 50 would hardly have had a chance to kick in. Elderly female nurses would have to wildly outnumber elderly males. Do you have any thoughts? I think they're saying historically that because there haven't been very many men that things haven't been able to even out.
Yeah. Unfortunately, I'm still not fully understanding it. So the idea is that the percent of men in nursing is obviously small. It's been sort of for the last 10 years about relatively consistent at like 9 to 10%. So I guess what this question is asking, like, what is happening to the earnings profiles as these men age, or what is? Do you think I'm understanding that correctly?
I think so.
Yeah. So I mean, I guess that's a good question. We haven't. We will have to see how this trend unfolds as as this as the workforce ages, and maybe that will then allow us to understand these effects better.
Great. Sorry for that one. I know sometimes it's a little tricky when we're typing to understand questions, so my apologies. I have another comment. Perhaps trade unions like California Nurses Association could provide wage setting information and also provide information regarding premium pay, such as charge nurse pay. Have you looked into those sources for any data?
Yes, that's a very interesting comment as well. We have been contacted actually by the California Nurses Association last year to ask whether we would be interested in using that data for this analysis, and we definitely are. It's just a matter of time that we haven't gotten around to these analyses, but state-specific information would certainly help advance the questions on this topic.
I have a question myself.
Mm-hmm.
What do you think that a particular hospital or setting policies regarding like diversity or maybe equality in the workplace or anything like that that are just in place at particular locations, not something that's government regulated? What do you think that role is playing in perhaps maybe trying to attract men to a predominantly female profession by offering them higher pay to try to meet those sorts of standards? Do you think that that's playing any role in this?
Yes, another terrific question. I do think it is playing a role, and I think it is sort of for the nursing profession as well as for the employers to sort of discuss and decide whether we would want to reward this type of diversity, right? So from an economic framework, you could think that if having more men in the workplace creates a better work environment for the colleagues, if it creates if patients really enjoy having male nurses on the units and they'd be happier being cared for by a male nurse, these are all potentially strong factors of why we would want to reward that with like monetarily. So there is so this is very difficult to test with data. There is sort of qualitative data on whether patients prefer what sort of sex of the provider they would prefer. And there is a general, the literature seems to suggest that on average patients prefer a female nurse. So there are clearly specialty areas and certain situations where you would for sure, right, prefer a male nurse. And so that is just, let's say in gynecology, women will probably prefer having a female nurse versus in urology, patient will probably prefer for sure like a male nurse. So those are clinical areas where there is a clear preference for a man. I think mental health is another area where there might be a preference for having a stronger preference for having male nurses on the units. But these are very difficult and sensitive conversations to have. And with regards to like benefits to colleagues and administrators and so on, whether that is a benefit that we might want to reward is really, you know, it's difficult to come up with answers for this, and we don't have a way of testing that in the data that we have. But I think these are questions that we should think about and also try to find answers for.
Thank you, Uli. That's great. I have one more question for you. I think this may follow up kind of to my question. Have you considered examining bias in management towards men and assigning premium pay shifts or premium assignments?
No. So I think what this question is asking is, like, let's say there are some higher paying shifts available, and both a man and a woman would be interested in taking that shift. Are there biases from managers to assign those shifts to men? We have not looked at that. In the German data that I briefly mentioned to you at the end, we do have some very interesting questions available that have asked about number of night shifts and other types of shifts, and we did not see there that men selected into, like, assuming that night shifts pay more, into those shifts more than women did. But there's definitely been other evidence coming out of sociology mainly that has looked at the glass ceilings and the roles of, specifically also within nurses and nurse managers, and there does seem to be evidence, not on studies that we have conducted, but that have come out of other areas of the literature that have shown that male nurses do move up the career ladder faster than female nurses do.
Great. I have a question that I believe is methodology based. They're asking, what about using decomposition technique to examine to what extent the endowment and coefficients effects contribute to these gaps?
Yes, fabulous question. We have actually conducted all our analyses in all methodological ways possible. So the findings that you've seen reported sort of were chosen for a medical audience, but it is really remarkable how consistent these effects are, regardless of the methodology chosen. So we have used OACA decomposition effects, both with two-way and three-way decompositions. We have also used hourly wage instead of annual earnings, and they're depending on whether you are more looking at these types of analysis from the eye of an economist versus a sociologist versus a health services researcher, depending on where you publish these findings. Different specifications are preferred. So one thing that I am very confident about, given the extent and the different types of analyses and the different data sets that we have used over time, is that these are really real effects. And OACA decompositions show also that about a half to 2/3 of the earnings gap is explained by endowment effects.
Okay, there was a second methods question. You may have just answered it, but you can just repeat that you tried everything. Why don't you try using the full adjusted model to examine the motivational differences between male and female?
Or instead of the proportions test that we used, I suspect that's the question.
I believe so.
Yeah. So I mean, these are binary variables. So I think I have to think about how we would use that in a regression framework. If that person would be able to comment a little bit more on that, that might be helpful for me to take the question more forward than what I have done. We just have bivariate measures. Oh, maybe the question is whether, like, changing state or changing, let's say, changing for promotion as an outcome, adjusting for other variables. Yeah, that's a possibility that that could be done as well. Sorry, I'm just thinking about it. Yeah.
Okay, great, Uli. I'm going to ask you just a general question about where you see maybe any more of this work going in the future, or if you are planning to look at other areas of nursing wages or any other future research you're working on. And I'll give one last call for questions to the audience.
Thank you, Chrissy, for that question. So I have, so one way is to certainly bring in institutional level data, and not that I have access to those data at this time, but I think that would be a really advantageous to answering some of these open questions. Would we really see this wage gap if we know that these nurses worked, let's say in the same hospital? Because this definitely would have very specific implications for sort of policy interventions for organizations. A second area that I think has potential perhaps is extending some of these questions into, especially regarding patient preference, into a laboratory setting. So, for example, you could think about an experiment where patients are given a care scenario that includes, let's say, a dressing change carried out by like Amy, and then another group of patients that's getting described the same care scenario, but the provider is James, right? And then you can potentially ask, like, how satisfied were you with the service that you received, and how much would you be willing to pay for the service? So this would sort of perhaps get at understanding some of the underlying gender biases in this area, and also at patient preference, because you might imagine that on average both that there is a preference for a female nurse, but then what the data might show potentially is that even though there is this preference for a female nurse, you would be willing to pay the male nurse more. And this would show a phenomenon called preference reversal, which in behavioral economics is a very interesting phenomenon. And I would love to see whether some of these dynamics are in play within the nursing setting.
Great. Well, thank you so much, Uli. We'd like to say a big thank you for you to taking a time out of your schedule to present with us and bring us this great information. I have no doubt that this will be helpful for people going forward, and especially thinking about ways that we can kind of address this issue and explore it further. Pete, did you have any last thoughts before we close?
Christy, no, I don't. Well, I do have a quick question, Uli. In your look at the international, the global perspective, are you seeing any patterns in which the wage inequality between men and women is different systematically by whether or not, say, the country has a free market or is a more regulated market, or, say, developed versus non-developed countries, Eastern versus Western countries? Is there any sort of pattern that you're aware of?
Right now, I've only looked at German data so far, but I do find it very interesting that even within that labor market that I try to explain is more homogeneous and has a lot more liberal family-friendly policies, that we still see this wage gap. So it sort of tells me that maybe these policies alone aren't able to help address the underlying biases that we might have. So that's all I would be able to say, I think, at this point about that.
Thank you, Uli.
All right, well, that will conclude our webinar today. Thank you so much to our presenter, and thank you for all your attendance. As I mentioned, we're currently organizing that short series of webinars focused on the state of primary care in the U.S., how the RN workforce can help, and discuss the recommendations of the Macy Summit. So be sure and save the date for October 26th at 2 p.m. Eastern Standard Time for the first of this series. Thank you very much. Have a great day.
Thank you.
Hey, Uli?
Yeah.